Hello, a very good evening to all of you. I'm Sayukta from Prostate Wellbeing Team, and I'm sure all of you must be doing good. So, today, the topic of this session is very important. We are going to talk on benign prostatic hyperplasia, BPH, or what we normally call as or known as non cancerous enlargement of prostate. And to brief us on this, we have with us renowned urologist, Dr. Shrinivas RP. Dr. Shrinivas RP is from Bangalore. His MS in General Surgery, DNB Urology. He has a rich experience and hands-on expertise on stone management as well as in treating urological problems. He is currently practicing at Manipal Hospital Whitefield, Bangalore. A very warm welcome to you, Dr. Shrinivas RP. It's a pleasure to have you.
Thank you. Thanks a lot. Greetings of the day to you also and all our viewers.
Thank you, doctor. And today, as we are going to talk about BPH, benign prostatic hyperplasia, which is due to the prostate, which is a gland present in males. First of all, doctor, what is the role of prostate and what is BPH? How it becomes large in size?
See, prostate is a gland which is present in all men since we are born. Okay, no. So it's an accessory reproductive organ. It is
Yeah.
mainly in the urinary passage. Okay, it's also part of the genital system. So it helps in sperm production. It helps in semen maturation. It helps in ejaculation. So, but the gland is usually very active in the earlier part of the life. As the man grows older, beyond the age of 50, it starts enlarging, causing some problem with urination. So that's when we call it as benign prostatic hyperplasia, which is age-related enlargement. It is not some abnormal enlargement. It is not a cancerous enlargement. It's an age-related enlargement. How the hairs can become gray, eyes can develop cataract. This gland also around the urine passage starts enlarging, causing some problem with urination. Sometimes complications, sometimes problems.
So it's a sign of aging. Just as we grow old, the prostate also becomes large in size, and prostate is a gland which is present in men. Now, doctor, because we are talking about BPH, and it's important to now know about these symptoms. What are these symptoms? If the symptom persists, then a person should come and consult the urologist.
Generally, the person who is in question, who goes through this prostatic enlargement according to his age, generally he will notice that he will have to wake up multiple times at night. The most disturbing symptom is that it spoils your sleep. It definitely reduces the daytime productivity, and it also makes you pass urine very frequently during the daytime. You will not be able to do anything productive. You'll have to take a break in between. You can't travel. You can't do specific activity for a specific significant period of time. And it also creates the sense of urgency where you must rush to the washroom even when you get a warning. By the time you can actually make up your mind, socially look for a situation to go and pass urine, so you will not be able to relieve yourself in a comfortable way. You must rush to the washroom. Sometimes urine leaks onto their undergarments. It makes it very embarrassing. It can create an accident kind of a thing. And whenever the man is in the washroom, when he wants to relieve himself, urine doesn't come when he wishes. It makes him wait for the stream to start, or it doesn't happen in one stream. It comes in multiple installments, and the speed is not
Right.
good, and he cannot empty it properly. All these are symptoms that can happen. Sometimes these are simple symptoms, but sometimes it can complicate in the form of bladder stone, or it can cause kidney dysfunction. It can cause a sudden blockage of urination, where for the last 4 hours you're not passed urine, not a drop is coming, you're in a hurry to pass, and you must rush to the hospital for an emergency to get yourself relieved. So these are all the symptoms of prostatic enlargement.
Right. So the symptoms you just mentioned regarding frequency or urgency, or many a times, as you said, leakage also happens. Doctor, how important it is to come up and consult a urologist, because many a times people say that, I'm aging, so I'm bound to have these symptoms, or maybe I'm diabetic, etc., etc. So many times they don't realize that this is due to the enlargement of prostate and they need to go and consult the urologist. So why it is so important to treat it?
See, there are two dimensions to it. One is you must go to urologist, because these symptoms, whatever I mentioned to you, are themselves very much bothersome. They're bothersome to the extent that you'll have to, because it's affecting the quality of your life. So you'll have to seek medical care because you're not happy with the quality of life that you are having. So therefore, you must visit a urologist. Basically the quality of life issue, the symptom issue itself is enough. It's rather, put in other words, it's a degree of bother. How much are you bothered by this urination urgency? How much are you bothered by this frequent waking up at night? Or the stream, and are you happy with that? Ultimately, it's your bother. That is one level of the reason to go to a urologist. Second level of reason to go to urologist is, you will develop some complication. What is the complication? Either bleeding, you will pass blood in the urine, or you'll keep developing repeated UTI, repeated in episodes of urine infection. That's also a reason to go to a urologist, because you treated yourself, but you still keep getting it. You do not know why, in spite of doing everything right. And third, bladder stones. A big stone can develop in the bladder. So that's also a secondary complication of prostatic enlargement. You can develop kidney failure because both the kidneys are obstructed. The kidneys are swollen. There's also a reason to go to a urologist. So there are complications, or kidney failure, or sudden blockage. Not a drop of urine is coming for whatever, half a day or 4 5 hours or 6 hours. You are in severe pain. You must rush to the hospital. So these are the second levels of reasons to meet a urologist.
Right. So it's important because if you don't get it treated, then there are potential complications. And plus, anyways, even if there are not potential
Yes.
complications, then also your quality of life is getting hampered. Now,
True.
doctor, when a person comes to you with these symptoms, are there tests that you normally recommend for diagnosis, or just by clinical investigation and taking the history, etc., it works?
So the person in question definitely requires investigations. Okay, now whatever diagnosis we mentioned, there are a lot of overlapping symptoms because of other problems also. So therefore,
Right.
we need to investigate, in the form of blood test to know the kidney function, to know the sugar numbers, because sugar in the background, when there's diabetes in the background, it can also affect this, or urine microscopy to see, if there's any urine infection. Urine infection also can cause similar symptoms. It can be a complication, it can be a differentiating symptom also. Plus, you may have, you need ultrasound scan to see how are the kidneys, how is the prostate gland, and what is the bladder capacity. Is the capacity good enough? Is the bladder emptying properly? That we must check. Plus, we must do one more test called as a flow test. What is the speed at which urine is coming? See, subjectively, I feel my speed is good, not so good. But how do we objectively know? There's a machine into which you must pass urine. It will measure the urinary speed in the form of a graphic picture. So that's how we come to know whether enlargement has happened or not. Okay, no. So these are
Right.
the ways the doctor will assess you. Plus, doctor will physically examine you also before sending you for a test. Will examine you also. In the genital area, in the rectal area, he will examine. He can make an assessment. Yes, please.
And doctor, in case the person is asymptomatic, no symptoms, as you mentioned, but then when they go for annual medical checkups or maybe ultrasound of any other organ, they find out that their prostate is getting large. In that case, what is the treatment, or what advice you normally give to that patient?
So there's also a very good scenario where the other extreme, people are unnecessarily worried. They do a health checkup, prostate is enlarged, or some physician refers to urologist saying that there's enlargement, just go. They're worried. There again, the same thing, whatever we discussed, to summarize in a different way. If there is no symptom, just imagine we have done full investigations, there is no symptom at all, and in the ultrasound or uroflowmetry, there are no complicating factors. Yes, enlargement is there is some flow affected, but still there's no complicating factor. Then you need not treat. As long as the patient is not having symptom and the flow is not significantly bad, nothing to be done. If they require watchful waiting, regular monitoring every 6 months or 1 year, that's required. Plus one more test called as therapy. But if you see in any of these reports, not just prostate enlargement, if you see some complicating factors like stone formation, already too much kidney swelling, or some other infection indicators, then you must think prostate is the cause of all that and treat the prostate. So therefore, you must look for complicating factors or symptoms. That's when we take it forward.
Right. And doctor, what are the treatment options available for BPH?
Treatment options, depending again on these factors, depending on the patient's symptoms. The treatment options is in the form of drug therapy. See, basically before that, you can also think of lifestyle modification. What is lifestyle modification we are thinking about? How you manage your fluid, how you manage your other food intake, how you manage your caffeine intake, or in case alcohol intake. All these to be monitored. Plus, for example, just before bedtime, reduce the water intake, just before you're traveling somewhere, you know that you can't do a travel of more than 1 or 2 hours. Before that, you need to make sure that you will reduce your water intake, empty your bladder, understand, and if required, safe thing, take a break, take a break from the journey. All these things will matter. These are lifestyle modifications. Plus, intake of caffeine, intake of alcohol, all this will affect. Plus, depending on the requirement, we start them on drug therapy. There are simple drugs called as alpha blockers, which are relatively very safe drugs. Those drugs can be started and again monitored, depending on the suitability, depending on the complication. This is the drug thing. And there are very few set of patients who end up requiring surgery. Surgery again is in the form of minimal invasive therapy, in the form of TURP or laser prostatectomy. Some people require even bigger surgeries. Yeah.
Doctor, one clarification we would like to have from you, and that is for the drinking pattern that we have in our society, the liquid consumption. We normally say drink as much water as you can. Many times people get up in the morning, they'll have one jug full of water. Before going to bed, they'll have one jug or maybe one glass of milk. Even when they are getting up to void themselves in the night, they will again have water and then they settle down, and then they complain that I'm going to I have these symptoms of frequency urgency, etc. Does drinking adequate water or water intake or liquid intake, it has like a relationship with BPH?
See, the thing is, water intake is a very, very delicate item, because many people, sort of think blindly, okay, I must drink a lot of water and I must do this, things, because they come with a blind, idea. But the point is not that. The point is, you must drink sufficient amount of water. That's very important for your kidneys, very important for all the organs, including urinary system. It's very essential. But it's the distribution of the water intake. It's more in practical terms. How practically you distribute your water intake. For example, you must take. For example, there's a 24 hours requirement of say 2-3 liters or 3-4 liters, depending on the person. And one more thing is, people ask how much water should I take. There is no fixed amount of water to be taken. It depends on the situation. Depends on like the weather. For example, a hot summer day, you must drink more water. Winter time, you drink less water. You're sitting in the AC room, less water. If you've done a lot of one more thing, depends on physical activity. Are you very physically active? If you're very physically active, you've done a lot of walking, or walking in the hot sun, you must drink more water. A day on a weekend, you're sitting lazily at home, not doing any activity, therefore you must reduce the water intake. So all these things to be moderate. Plus, we can't fix the water intake. And second thing, if you already know how much water to take, depending on the body requirement, you must distribute it accordingly. Where during the day, when you are not traveling much or not doing any other activity, you can drink a lot of water. But as the day ends, last 2-3 hours, you must reduce the water intake so that night is not disturbed. So the water distribution timing is also very crucial.
Right. And one more question, doctor, because we are talking about benign prostatic hyperplasia, that is enlargement of prostate, which is non-cancer. But because prostate cancer is also an issue, I just want to ask you: are the symptoms similar in both the cases, benign and prostate cancer?
Yes, there is one problem, because prostate cancer is not at all as common as benign thing. Benign thing is a normal
Mhm.
variation. So prostate cancer
Right.
is very, very less common. But it is true that in many people, the prostate cancer is missed out, because we because the symptoms are very overlapping. Sometimes even prostate cancer, like just like benign cancer, benign enlargement, it is totally asymptomatic. Your patient may not have any symptom. It may be just incidentally health checkup, picked up cancer. So therefore, people need to be very careful. They can't take it for granted that the symptoms are not there, so therefore no cancer possibility. So the symptoms are very much overlapping. There are hardly any change, difference between the two. Yes, in the cancer's enlargement, if it is advanced cancer, you may have bone pain, you may have body pain, hip pain. That may be a sign of advanced cancer. But none of this, symptomatic wise, patient can detect it. Only a doctor has to examine, or blood test has to tell us, or some MRI should tell us. So that's the only way to know.
Right.
Patient cannot make out the differences.
It becomes even more important to consult a urologist in case you have these symptoms.
Yes.
Doctor, before we wind up the whole session, any take home message for our viewers?
See, the thing is, we need to have a delicate balance between unnecessary anxiety about prostate enlargement, prostate cancer, because of too much information there in the net. At the same time, you should not be careless or you should not ignore it. Okay, it's a part of my age, and why should I even be worried about it? Okay, no. So that also should not be the thing. It should be delicate balance. Have a health checkup. Be in touch with your physician. Be in touch with your urologist. Follow the advice. And you can always be regular with your diet and water intake, those kind of things.
Absolutely. Thank you so very much, Dr. Shrinivas RP. It was wonderful talking to you. Thank you for this very informative session.
Thanks a lot. Thanks for having me. A pleasure to be here. Thank you.
Thank you, Doctor, and viewers. Thank you for joining us for your excellent participation. Stay happy, stay healthy, and take care of yourself. Have a great
Take care.
evening ahead. Goodbye.
You too. You too. Goodbye. Bye bye.
Thank you, Doctor.